Hi guys, it's me, Professor D, and welcome back to my channel. On this video, we are going to be covering pharmacology. Guys, you need pharm so much because let me explain this to you. So many questions about medications are laced in and out of numerous questions from your first semester of the nursing program when you're doing fundies and pharm to the very end when you're actually preparing for NCLEX, okay? So it's really important to know these concepts about the most common meds that you're going to see once you hit the floor. If you haven't done so already, please don't forget, go ahead and like and subscribe below, and let's get started. The nurse is assessing a client who's on long-term glucocorticoid therapy. Which of the following findings would the nurse expect? A, buffalo hump. 2, increased muscle mass. 3, peripheral edema. D, jaundice. If you're new to my channel, guys, just go ahead and press the pause button. Give yourself time to look at the question, the answers, and when you feel like you're ready, just go ahead and press play and we'll continue. So guys, the correct answer is A, buffalo hump. What are we thinking? Cushing's, right? Because when a patient has too much glucocorticoids, it throws them to what? Cushing's. And the sign and symptom of Cushing's disease is the buffalo hump. Okay, so they gave us a clue when they said long-term glucocorticoids. All right. What else is important to know about glucocorticoids? I tell you guys all the time when it comes to these steroids, there are 4 important things to know. 1, they increase your blood glucose. 2, they're hard on the stomach. They can give you ulcers. 3, they mask the signs and symptoms of infection. So you better be watching that patient closely. You better be taking their temperature more often, looking at the WBCs, anything. If they have drainage, look at the type of drainage. Make sure it's not purulent. Make sure it's not malodorous. Anything that will give you a hint that there's an infection going on. And 4, it places the patient at risk for fractures because it makes the bone more porous. So those are some very important things for you guys to know about steroids. A client is receiving digitalis. The nurse should instruct the client to report which of the following side effects? A, nausea, vomiting, fatigue. B, rash, dyspnea, edema. C, polyuria, thirst, dry skin. Or D, hunger, dizziness, and diaphoresis. And guys, the correct answer is nausea, vomiting, and fatigue. Also, other signs and symptoms besides those are patient can become anorexic, they won't want to eat, and bradycardia, okay, slowing down the heart rate. DIG, you need to know the normal range, which is 0.5 to 2. And just so you guys know, let's say you guys get a question about a common side effect of a med, and you have no clue what the answer is. If you see nausea and vomiting, pick that. That's not always the answer, but nausea and vomiting just happens to be a very common side effect of many medications. So if you're in a bind, you have no idea what the answer is, a best guess would be nausea and vomiting. Obviously, guys, if you know what the answer is, don't choose nausea and vomiting just because it's there. I'm talking about if you have no clue what the answer is. The provider has ordered transdermal nitroglycerin patches for a client. Which of these instructions should be included when teaching the client about the use of these patches? A, remove the patch when swimming or bathing. 2, apply the patch to any non-hairy area of the body. 3, apply the patch with chest pain. Or 4, remove the patch if ankle edema occurs. And the correct answer is B, apply the patch to any non-hairy area of the body. Why? Because we need that patch to be able to stick to the skin because that medication is absorbed through the skin. So obviously we need it to be able to stick. And if there's hair on the body, that medication is not going to be absorbed completely and is not going to be absorbed evenly. So you're going to teach that patient to put it on a non-hairy part of the body. Now remember, nitroglycerin, this is a vasodilator. So will lower the patient's blood pressure. So this is also something that you do want to be watching out for, the patient's blood pressure. A client with anemia has a new prescription for ferrous sulfate. In teaching the client about diet and iron supplements, the nurse should emphasize that absorption of iron is enhanced with which substance? A, acetaminophen, B, orange juice, C, low-fat milk, or D, an antacid. I can't speak today, guys. And the correct answer is B, orange juice. Why orange juice? Well, orange juice has vitamin C in it. What's the vitamin C? Your ascorbic acid. Okay, it's the ascorbic acid that makes the iron be absorbed. So whenever a patient's taking iron, they need to be taken with something that has ascorbic acid that has vitamin C in it for it to be absorbed completely. Couple things you need to know about iron. I talked about this in my other pharm video, but ferrous sulfate, which is iron, it comes up so many times in pharmacology. I'm going to explain it again because you need to know this. So very quickly, when it comes to iron, it needs to be taken on an empty stomach. You don't want the iron trying to compete with receptor sites in the gut, okay? It needs to be taken with ascorbic acid, your vitamin C, in order for it to be absorbed. If it's given orally, especially with peds, you're going to teach the parents to give it through a straw because it stains the teeth. Iron will change the color of a stool to very dark, tarry color. You have to tell the patient, warn them in advance, or they'll completely freak out, wouldn't you? Tell the patient drink lots of fluids. Iron is very, very, very constipating, so they need to drink lots of fluids and take in lots of fiber. And 6, what's the 6th thing, important thing about iron? Oh, if it's not given enterally, which means it's going by the GI tract, right? Let's say it's given parentally, such as in an IM injection, and that's how it's going to be given. If it's given parentally, you're going to be given an IM. You have to use the Z-track method. And the Z-track method, the purpose of that method, number one, IM, it goes deep into the muscles, but more importantly, it seals in that medication, okay? Because remember, that medication is very staining. Next question. A pregnant woman is hospitalized for treatment of pregnancy-induced hypertension, PIH, in the 3rd trimester. She is receiving magnesium sulfate IV. The nurse understands that this medication is used mainly for what purpose? A, maintain normal blood pressure. B, prevent convulsive seizures. C, decrease the respiratory rate. Or D, increase uterine blood tone. And the correct answer, guys, is to prevent seizures. Now, a side effect of magnesium sulfate is hypotension. It brings down the blood pressure. However, as students, you guys tend to get it confused and you think that would be the indication. We have so many other meds out there that work wonderfully to bring down patients' blood pressure without the other adverse effects of magnesium sulfate. We're not going to give magnesium sulfate strictly to bring down a patient's blood pressure. We have other meds for that. The reason we give it in pregnancy is to prevent seizures. But at the same time, it also does bring down the patient's blood pressure, which is great. But there's some adverse effects of magnesium sulfate that you absolutely have to watch out for. What? It relaxes muscles, and it might relax muscles to the point that the patient may have decreased deep tendon reflexes. So when a patient's taking mag sulfate, you better be checking their tendon reflexes, because a sign of toxicity is once you see those decreased deep tendon reflexes. A client's receiving erythromycin 500 milligrams IV every 6 hours to treat pneumonia. Which of the following is the most common side effect of this medication? A, blurred vision. B, nausea and vomiting. C, severe headache. Or D, insomnia. And the most common side effect is, you guessed it, nausea and vomiting. Now, guys, there's a difference between side effect and adverse effect. So a side effect is something that may possibly happen to the patient taking this med. And so you warn the patient, you know, this may happen. So you're giving them a heads up. It's not something you want to happen, but it may happen. An adverse effect is something that may happen when the patient takes this medication, but you do not want it to happen at all. And matter of fact, you tell the patient, if this happens, call us right away. I have to notify the doctor. The doctor might have to change your prescription. You see the difference? So side effect, you're warning them, may possibly happen. Adverse effect, it may happen, but under no conditions can you allow it to happen. So if it happens, we need to know right away. All right? A 4-year-old child admitted with burns on the legs and lower abdomen. When assessing the child's hydration status, which of the following indicates a less than adequate fluid replacement? A, decreasing hematocrit and increasing urine volume. B, rising hematocrit and decreasing urine volume. C, falling hematocrit and decreasing urine volume. Or D, stable hematocrit and increasing urine volume. And the correct answer is B, rising hematocrit and decreasing urine volume. When a patient's going through dehydration, one of those signs and symptoms of dehydration is increased hematocrit. You're going to see the hematocrit go down. You're going to see the hematocrit go up. Excuse me. You want to know what goes down? The urine output. And I want you to think about this. Remember, I told you, your body is meant to survive no matter what. So the minute you start going through dehydration, those kidneys shut down. Your kidneys are freaking out. The kidneys are like, you know what? I don't know what's going on, but we already don't have enough fluids, so we're going to hold on to what we have. So the kidneys clamp down. The kidneys are not letting anything out because they're trying to hold on to. They're trying to conserve the little bit of fluid that you do have left. So that's why you see the urine output go down, but you see the hematocrit go up. Prior to administering alteplase TPA to a client administered with CVA, it is critical that the nurse assesses A, neuroscience, B, mental status, C, blood pressure, or D, PT-PTT. And the correct answer is D, checking the PT-PTT. So I want to explain this to you guys. When a patient has a stroke, yes, we love TPA. Yes, TPA must be given within 3 hours, right? For it to have the maximum benefits. Yes. But before we give it, we have to make sure that that patient has a thrombic stroke and not a hemorrhagic stroke. Why? I want you to think about it. What is the action of alteplase? What does TPA do? It breaks up clots. So imagine if this patient had a stroke, but it wasn't a stroke by a clot. It was a stroke from bleeding. It was a hemorrhagic stroke. They were bleeding in the brain. And here you go, being super nurse or thinking you're super nurse, giving this patient TPA before you check that PT and PTT, and you did not realize that the kind of stroke that patient had was a hemorrhagic stroke. That patient's already bleeding out in the brain, and now you gave them something to bleed further. You probably just killed that patient. So you better, before you give that TPA, you're going to check that PT, PTT. And usually what they do, they'll do a CT scan. They'll look at the brain and make sure that brain is not bleeding before they give that TPA. So yes, we love TPA. Yes, it's a great med for strokes. Yes, you want to give it within 3 hours. But before you give it, you want to make sure that it's not a hemorrhagic stroke, that that patient isn't already bleeding out so you don't make the condition worse. A nurse has been named in a lawsuit. A nurse who has been named in a lawsuit can use which of these factors for the best protection in a court of law? A, clinical specialty certification in the associated area of practice. B, documentation on the specific client record with a focus on the nursing process. C, yearly evaluations and proficiency reports prepared by the nurse manager. Or D, verification of providers' orders for the plan of care with identification of outcomes. And the correct answer is B, documentation on the specific client record with a focus on the nursing process. The only way to prove that you did what you were supposed to do is that documentation. Remember, if it's not documented, it never happened. It doesn't matter that you were awarded Best Nurse of the Year for 20 years in a row. It doesn't matter that you followed the doctor's orders, because guess what? If the doctor wrote a bad order, the doctor wrote an order for a medication that's 3 times the safe dose, and you give that medication, guess who loses their license? You, because you were the last person before that patient got the med. Okay? So it doesn't matter what that doctor wrote. It matters what you did, and you need to do the right thing, and you need to document that you did the right thing. Okay? That's what's going to protect you. 4 or 5 years later, when you're sitting down in a deposition, you don't even remember the patient, much less what you did. All you have to go on is your documentation. So make sure it's up to par. The nurse is caring for clients over the age of 70. The nurse knows that due to age-related changes, the elderly client tolerates diets that are A, high in protein, B, high in carbs, C, low in fat, or D, high in calories. And the correct answer, guys, is C, low in fat. And I want you to notice something. Let's say you had no idea what the answer was. No idea. If you look at these choices, you'll notice that only one answer is different. Everything says high, high, high. Only one says low, and that's your fat. And that's the correct answer, guys. So I'm not telling you to use this trick all the time. No. If you don't know what the answer is, you have no clue. One of the tricks, and I taught you this in my 11 tips to pass NCLEX video. I told you to look for an oddball, and the low fat is your oddball in this group of questions. So let's talk about this particular question. The geriatric population. Guys, it's wear and tear of the body. You know, the pancreas isn't working as strong as it used to, so it's not releasing those enzymes like it used to, so it's not breaking fat down like it used to, right? So they can tolerate low fat. And that goes for everything, guys. It's just wear and tear of the body. Okay, they can't tolerate high doses of anything, so they'll most likely tolerate the low fat. You want low fat, low carbs for this patient. That's what they tolerate best. A client's to receive 3 doses of potassium chloride, 10 MEQs, 100 cc's normal saline to infuse over half an hour. Which of the following is a priority assessment to perform before giving this medication? A, oral fluid intake. B, bowel sounds. C, grip strength, or D, urine output. The correct answer is D, urine output. You guys know that potassium has a very narrow therapeutic range, 3.5 to 5. That is it. Anything outside of that, you're possibly throwing that patient into a dysrhythmia, right? So you want to keep it 3.5 to 5, very narrow therapeutic range. And before you give a patient potassium, you better check the kidney function. You better check the BUN. You better check the creatinine. You better check the urine output and make sure that they're urinating at least 30 mLs per hour. Why? If they're not urinating, they're not going to be able to excrete that potassium and get rid of it. And guess what? Very quickly, they will accumulate a toxic level of potassium. And guess how we kill our inmates in the state of Florida? Potassium! Okay? Potassium will kill somebody quick. That's why it has a very narrow therapeutic index. 3.5 to 5. That is it. We don't play with potassium, ladies and gentlemen. So before you give it, you better make sure that they're able to excrete this medication or you're in big trouble. A hypertensive client is started on atenolol to Norman. The nurse instructs the client to immediately report which of these findings? A, rapid breathing. B, slow bounding pulse. C, jaundice, sclera, or D, weight gain. And the correct answer, guys, is B, slow bounding pulse. What is atenolol? Those meds that end in LOL, atenolol, LOL, They're what? Beta blockers. What do beta blockers do? They bring down the blood pressure, okay? So they could cause hypotension, but it also slows down the heart rate. So don't forget, guys, you want your heart rate to be between 60 and 100. You want that blood pressure to be 90/60 to 140/90. Those are your therapeutic ranges. So yes, beta blockers are wonderful meds. They bring down the blood pressure, but they also slow down the pulse. So if that pulse slows down too much, where it goes below 60, do you think your organs, such as your eyeballs, your brains, your liver, your spleen, your kidneys, all of those organs, do you think they're being perfused enough? No, because when the heart rate slows down, slower than that 60, not enough blood is being pushed out of the heart. And remember what's in the blood? Oxygen, vitamins, nutrients. So that means not enough oxygen, vitamin, nutrients are actually being fed to the tissues of those vital organs. So you want to make sure that it doesn't bring the blood pressure too low. You want to make sure it doesn't bring the heart rate too low. Okay, those meds that end in LOL are beta blockers. Brings down blood pressure and it also decreases heart rate. A client is scheduled for an intravenous pyelogram. After the contrast material is injected, which of the following client reactions should be reported immediately? A, feeling warm. 2, face flushing. 3, salty taste. Or D, hives. The correct answer is hives. Guys, if the patient starts having hives, this is a symptom of a true IgE-mediated response. They're having allergic response, okay? They're having a reaction, and yes, you're going to report this, but there's a couple things you're going to do before you report this. Now, just for the sake of this question, none of those were other choices, so that's why you chose obvious, well, let me back up. The way the question is asked, it said which one you're going to report immediately, and it's hives. But let me explain to you, because I want you to know this as well. There are a couple things you're going to do before you report it. And you have to know this, because if you have a question to ask you what's the priority, it may not be reported to the doctor, because there are a couple things you do before you report to the doctor. So the moment you see the patient breaking out in hives, the first thing you do is turn off the IV. You shut off whatever it is that's offending that patient. You flush their system. You give a normal saline, you flush their system. You do a quick assessment. It's not going to be a long, drawn-out assessment, but a quick assessment. Remember, assessment is anything that gathers information. So it could be something as simple as looking at that monitors to see what the pulse and blood pressure is, right? Then you call the doctor, okay? Look at how many things you were able to do for that patient to save their life before you turned your back to call the doctor. You stop whatever it is that's harming them. You want to flush their system. And by the way, guys, anything that has contrast media is very hard on the kidneys, okay? So you're going to flush their system anyway to get it out, especially if they're having a reaction. You want to eyeball them. You want to do an assessment, right? Why? You run to call the doctor, and meanwhile, that patient can't breathe. And you could have done CPR. You could have saved them, but you're too busy calling the doctor. Do a quick assessment. A quick assessment can be something as quick as eyeballing them or looking at their monitor. Then you call the doctor to let them know what's going on so that you can get orders. Okay, something else that's important to know when it comes to contrast media, of course, as always, you want to make sure that the patient is not allergic to the contrast media. You want to make sure they're not allergic to the iodine. You want to make sure that they don't have shellfish allergies, because usually when a patient has shellfish allergies, they're allergic to the iodine that's being used for the contrast media. Okay, you want to make sure that you flush that patient system after they get the contrast media to get it out of their body, because the contrast media is very hard on the kidneys. You're caring for a hypertensive client with a new order of Capitan. What information should the nurse include in the client teaching? A, avoid green leafy veggies. B, restrict fluids to 1,000 cc's per day. C, avoid the use of salt substitutes, or D, take the medication with meals? And the correct answer is C, avoid the use of salt substitutes. So captopril, those meds that end in pril, what are those? Those are ACE inhibitors, and ACE inhibitors have a side effect of bringing up a patient's potassium, okay? So whenever a patient is on ACE inhibitors, you want to be watching their potassium and making sure it doesn't go out of that 3.5 to 5 range, okay? That's one important thing to do with your ACE inhibitors. Another important thing to do with your ACE inhibitors is to watch the blood pressure, because what do ACE inhibitors do? They bring down the blood pressure, right? That's the whole reason we're giving ACE inhibitors. But you want to make sure the blood pressure doesn't go too low, because you might put that patient in a hypotensive state. So you're going to watch the blood pressure. You're going to watch the potassium to make sure the potassium doesn't get too high. And you're going to make sure that the patient doesn't ingest anything high in potassium, such as salt substitutes. Salt substitutes are high in potassium. And we know potassium is a possible problem when it comes to ACE inhibitors. So you're going to be watching that very, very carefully. A woman with a 28-week pregnancy is on the way to the ER by ambulance with a tentative diagnosis of abruptio placenta. Which should the nurse do first when the woman arrives? A, give oxygen by mask 100%. B, start a second IV line with 18-gauge cannula. C, check fetal heart rate every 15 minutes. Or D, insert urethral catheter with hourly urine output. And the correct answer is A. You're going to give them oxygen by mask. And I know what you're thinking. You're like, okay, abruptio placenta, this is a medical emergency. This patient might hemorrhage to death. Why did we choose the oxygen and not the IV line? Well, look at what B says. It says start a second. If it says second, that means there's already a first, right? So that first one's already running to help keep those veins open and keep their fluid status up. So next you want to do what? Give them oxygen, because they may lose oxygen from the bleeding. That's why. So trust and believe, when this patient gets to the hospital, they're going straight to the OR. Okay? Why? Because abruptio placenta is a medical emergency. You want to make sure you keep the patient from going into hypotensive state. That's why you're going to be putting in a large bore catheter and giving them IV fluids, and you're going to give that patient oxygen. So that's why that is the correct answer. They're losing blood. You lose blood, you lose RBC. You lose RBC, you lose hemoglobin. You lose hemoglobin. What's in the hemoglobin? Oxygen. Okay? So that's why that's the correct answer. And I can't believe I'm already almost at my 30-minute mark. All right, guys. Last question. A client newly diagnosed with type 1 diabetes asked the nurse the purpose of the test measuring glycosylated hemoglobin. The nurse should explain that the purpose of this test is to determine A, the presence of anemia often associated with diabetes, B, the oxygen carrying capacity of the client's red cells, C, the average blood glucose for the past 2 to 3 months, or D, the client's risk for cardiac complications. And the correct answer is C, the average blood glucose for the past 2 to 3 months. Okay, guys, so I love glycosylated hemoglobin. That's your hemoglobin A1c. And here's why I love it. The patient can't trick you. Okay, it gives you a snapshot of what that patient's blood sugar has been looking like for the past 90 days. Okay, so for the past 3 months, you can see what their blood sugar has been looking like. Okay, otherwise, when that patient comes in for fasting blood glucose, as you guys know, you guys studied diabetes before, many of those patients, they're type 2, many of those tend to be non-compliant, and they can trick you. right? I know we're talking about type 1, but let me talk about type 2 very quickly. They'll try to trick you. So the night before they have to go to a doctor's office, they're going to only have salad, they only drink water all day, so that when they come in the next morning, they get their fasting blood glucose and the number's perfect. Oh, congratulations, you did such a great job, Mr. Brown. And Mr. Brown's like, yes, thank you. But meanwhile, you know, before that, all he was eating was cookies and cake, right? But with the hemoglobin A1c, the patients can't fool us. We know what they've been doing. Now, the type 1s don't tend to be non-compliant. Those type 1s, the reason the hemoglobin A1c is important to us, yes, again, it gives us a picture of what their blood sugar has looked like for the past 90 days, 3 months. And it tells us if we need to make any changes to the dose. When I say we, I'm talking about the nurse practitioner or the doctor. It lets the practitioner, the physician, know if any changes need to be made in the dosage of the medication, in the frequency of the medication. When I say medication, I'm talking about insulin, because if you're type 1, you have to get an exogenous source of insulin, an outside source of insulin, or you will die. Okay? It's not like type 2, where type 2s, you know, depending on how bad their blood sugar is, they might not need insulin. They might need oral hypoglycemics. No, if you're type 1, you have to get insulin or you will die. So anyway, the whole purpose of this spiel is to let you know the hemoglobin A1c, also known as the glycosylated hemoglobin, gives you the value, gives you a snapshot of what that patient's blood sugar has looked like for the past 90 days. And guys, I'm past my time. I hope this video has been helpful for you. Please, guys, don't forget to share this video with any friends, any classmates, anyone you know studying for their boards or major nursing exam. And of course, to support this channel, if you appreciate the message of this video and you want to keep them coming, guys, please support me by liking and, more importantly, subscribing to my channel. Thank you for sharing this time with me, and I'll see you next time.